My name is Cheryl. I have Polycythemia Vera, and I'm taking JAKAFI.
Before listening to Cheryl's story, please listen to the following selected safety information.
What is JAKAFI or JAKAFI XR? JAKAFI or JAKAFI XR, ruxolitinib, is a prescription medication used to treat adults with polycythemia vera, PV, who have already taken a medicine called hydroxyurea, and it did not work well enough or they could not tolerate it. It is not known if JAKAFI or JAKAFI XR is safe or effective in children for treatment of polycythemia vera. Important safety information. JAKAFI or JAKAFI XR can cause serious side effects, including low blood counts. JAKAFI or JAKAFI XR, ruxolitinib, may cause low platelet, red blood cell, and white blood cell counts. If you develop bleeding, stop taking JAKAFI or JAKAFI XR and call your healthcare provider. Your healthcare provider will do a blood test to check your blood counts before you start and regularly during your treatment. Your healthcare provider may change your dose or stop your treatment based on the results of your blood tests. Tell your healthcare provider right away if you develop or have worsening symptoms, such as unusual bleeding, bruising, tiredness, shortness of breath, a fever.
Please see additional important safety information at the end of this video and full prescribing information at jakafi.com.
I was working, and I remember at the time, I just really didn't feel well at all. I did a lot of planning of large functions, and I found that at certain times I was forgetting things. I found myself very tired and having a difficult time walking. I'd get out of breath. And that wasn't me. These things just kind of snuck up on me. And I thought to myself, I must be going through perimenopause, And I went and got checked, and my doctor said, we'll find out what's going on. I needed to go for more blood work, which was pretty scary all by itself. That confirmed the diagnosis that I have PV. I was experiencing itch, fatigue, and memory problems. The itch was getting out of control. I was having a really hard time taking a shower. PV was really impacting these moments in life for me where I could spend time with my family. I have granddaughters that dance, and they wanted me to go to their recital. I went to the first recital and I had to leave because it was so hot in there and I couldn't get comfortable. I think it was a struggle for everybody in my family. I really had a hard time going places. I was told it was time to go see an oncologist, and I was her first patient that had PV. So for 6 months, I had a phlebotomy every 2 weeks. Every 2 weeks, they would check my blood again, my red blood cells, my white blood cells, and my platelets. And the blood counts would be too high. And I told my husband, I can't do this anymore. It's just too much. I decided I need to advocate for myself. And so I was referred to another doctor. And this doctor seemed to understand PV a little bit better. I was still doing phlebotomies. She did them less frequent. She told me that she was going to leave her practice. So I was devastated, and I had to start all over again. I was referred to another doctor, and he said he just didn't know how he was going to be able to treat me. I moved on to an MPN specialist in Boston, where I was introduced to hydroxyurea. This medication was supposed to help control my numbers. My red blood cells were really high. I also had a very large spleen. Hydroxyurea was a struggle for me. It was months before it actually started to make a difference in my blood counts. My spleen started shrinking. I still continued to do phlebotomies at a regular rate of once a month with hydroxyurea. After 2 years, it stopped working for me. My spleen started to grow again. It didn't resolve most of my symptoms. I was still itching. I said to my doctor, I just can't do this anymore. It's just too out of control. That's when my doctor recommended JAKAFI. My MPM specialist said that it may control my hematocrit and reduce my spleen size. And I decided that I'm going to take the chance. When I first started taking JAKAFI, my red blood cell counts came down, my white blood cells came down, and my platelets dropped almost in half. Now they're lower and more controlled with JAKAFI. My spleen size came down, and I could just feel the difference in my body. I noticed I was able to not feel as full probably within a couple of months of taking JAKAFI. My spleen significantly shrunk to the point where I could lay on my back without being in pain. Within the first year, my spleen was almost completely normal. So I went from having phlebotomies every month to once a year. I couldn't believe it. And I could feel it. I could start to feel more like myself again. I'm enjoying spending time with my grandchildren, and I'm enjoying traveling with my husband. My husband and I have been camping for over 25 years. I could leave the camper more often. I've been able to take longer walks with my dogs, with my husband on the beach. But I love to crochet, and I learned how to crochet with my grandmother when I was about 8 or 9 years old. I have a giant garden in my backyard that I'm working on right now. It gives me a sense of comfort. When I first started feeling symptoms, knowing what I know now about PV, I would have brought them up sooner to my doctor. It's really important not to be afraid to say what's happening to you and how you feel. The changes that are going on in your body might seem insignificant to you. That's a big part of PV, are all the little symptoms that add up together. If you are feeling symptoms and anything is bothering you, keep a list of how you're feeling. Bring it all with you to your next doctor's visit. There are so many different symptoms that happen with having PV that you really need to keep a journal, and it also helps you to see your progression of the disease, because the disease can progress. I would have been more proactive about looking for a doctor that understood PV. If you're not being heard, then go find another doctor. Find someone that'll listen to what you have to say. Advocate for yourself. Going back through my life and the journey that I've had with PV and getting to this place in time has just been truly emotional. I am thrilled that this medication is even an option for me. If you and your doctor decide that this is the right fit for you, I strongly recommend JAKAFI. This is my personal journey with JAKAFI. Your results may be different. Talk to your healthcare professional and see if JAKAFI may be right for you.
What is JAKAFI or JAKAFI XR? JAKAFI or JAKAFI XR, ruxolitinib, is a prescription medication used to treat adults with Polycythemia Vera, PV, who have already taken a medicine called hydroxyurea, and it did not work well enough or they could not tolerate it. It is not known if JAKAFI or JAKAFI XR is safe or effective in children for treatment of Polycythemia Vera. Important safety information. JAKAFI or JAKAFI XR can cause serious side effects, including low blood counts. JAKAFI or JAKAFI XR, ruxolitinib, may cause low platelet, red blood cell, and white blood cell counts. If you develop bleeding, stop taking JAKAFI or JAKAFI XR and call your healthcare provider. Your healthcare provider will do a blood test to check your blood counts before you start and regularly during your treatment. Your healthcare provider may change your dose or stop your treatment based on the results of your blood tests. Tell your healthcare provider right away if you develop or have worsening symptoms, such as unusual bleeding, bruising, tiredness, shortness of breath, a fever, infection. You may be at risk for developing a serious infection during treatment with JAKAFI or JAKAFI XR. Tell your healthcare provider if you develop any of the following symptoms of infection: chills, nausea, vomiting, aches, weakness, fever, painful skin rash or blisters. Worsening of symptoms after interrupting or stopping treatment. Signs and symptoms of myelofibrosis may worsen after you stop treatment. Do not interrupt or stop treatment without talking to your healthcare provider. Tell your healthcare provider right away if you have any of the following after stopping treatment: fever, trouble breathing, weakness, night sweats, feeling dizzy or lightheaded, pain in left upper stomach area or left shoulder. Cancer. Some people have had certain types of non-melanoma skin cancers during treatment with JAKAFI or JAKAFI XR. Your healthcare provider will regularly check your skin during your treatment. Tell your healthcare provider if you develop any new or changing skin lesions during treatment. Increases in cholesterol. You may have changes in your blood cholesterol levels during treatment with JAKAFI or JAKAFI XR. Your healthcare provider will do blood tests to check your cholesterol levels about every 8 to 12 weeks after you start taking JAKAFI or JAKAFI XR and as needed. Increased risk of major cardiovascular events, such as heart attack, stroke, or death, in people who have cardiovascular risk factors and who are current or past smokers, while using another JAK inhibitor to treat rheumatoid arthritis. Get emergency help right away if you get any symptoms of a heart attack or stroke during treatment with JAKAFI or JAKAFI XR, including discomfort in the center of your chest that lasts for more than a few minutes or that goes away and comes back. Severe tightness, pain, pressure, or heaviness in your chest, throat, neck, or jaw. Pain or discomfort in your arms, back, neck, jaw, or stomach. Shortness of breath with or without chest discomfort. Breaking out in a cold sweat. Nausea or vomiting. Feeling lightheaded. Weakness in one part or on one side of your body. Slurred speech. Increased risk of blood clots. Blood clots in the veins of your legs, deep vein thrombosis, DVT, or lungs, pulmonary embolism, PE, have happened in people taking another JAK inhibitor for rheumatoid arthritis and may be life-threatening. Tell your healthcare provider right away if you have any signs and symptoms of blood clots during treatment with JAKAFI or JAKAFI XR, including swelling, pain, or tenderness in one or both legs, sudden unexplained chest or upper back pain, shortness of breath or difficulty breathing. Possible increased risk of new, secondary cancers. People who take another JAK inhibitor for rheumatoid arthritis have an increased risk of new, secondary cancers, including lymphoma and other cancers. People who smoke or who smoked in the past have an added risk of new cancers. The most common side effects of JAKAFI or JAKAFI XR include, for certain types of Polycythemia Vera, PV, low platelet or red blood cell counts, bruising, dizziness, headache, and diarrhea. These are not all the possible side effects. Ask your pharmacist or healthcare provider for more information. Call your doctor for medical advice about side effects. Before taking JAKAFI or JAKAFI XR, tell your healthcare provider about all the medications, vitamins, and herbal supplements you are taking, your medical conditions, including if you have or had low white or red blood cell counts, have an infection, have or had tuberculosis, TB, or have been in close contact with someone who has TB, had shingles, herpes zoster, have or had hepatitis B, have a high level of fat in your blood, high blood cholesterol or triglycerides, have or have had a blood clot, heart attack, other heart problems, or stroke, are a current or past smoker, had cancer, have or had liver or kidney problems, or are on dialysis. If you are on dialysis, JAKAFI or JAKAFI XR should be taken after your dialysis. Have any other medical condition. Women should not take JAKAFI or JAKAFI XR while pregnant or planning to become pregnant. Do not breastfeed during treatment with JAKAFI or JAKAFI XR and for 2 weeks after the final dose. How should I take JAKAFI or JAKAFI XR? Take exactly as your healthcare provider tells you. Do not change your dose or stop taking JAKAFI or JAKAFI XR without first talking to your healthcare provider. If you stop treatment, symptoms of your condition may return. If you miss a dose, take your next dose at your regular time. Do not take 2 doses at the same time. You may have regular blood tests during your treatment. Based on the results, your healthcare provider may change your dose or stop JAKAFI or JAKAFI XR. If you are prescribed JAKAFI, take JAKAFI 2 times a day or exactly as your healthcare provider tells you, with or without food. JAKAFI may also be given through certain nasogastric tubes. Tell your healthcare provider if you cannot take JAKAFI by mouth. Your healthcare provider will decide if you can take JAKAFI through a nasogastric tube. Ask your healthcare provider to give you specific instructions on how to properly take JAKAFI through a nasogastric tube. If you are prescribed JAKAFI XR, take JAKAFI XR 1 time a day with or without food. Swallow JAKAFI XR whole. Do not split, crush, or chew. Please see the full prescribing information, including patient information, which includes a more complete discussion of the risks associated with JAKAFI or JAKAFI XR at JAKAFI.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also report side effects to Insight Medical Information at 1-855-463-3463.